The first case was Dr. Nagla.
Yes, Dr.
Are you ready?
Yes, sir.
Okay. Okay, Mrs. Heba is 27 years old. She has been complaining of chronic diarrhea for the last 6 months. Blood investigation and colonoscopy confirmed that she has ulcerative colitis. The gastroenterologist decided to start steroid therapy for her. She read on the internet that steroid therapy has a lot of complications and side effects, and she decided not to receive it, and she wants to discuss with you this issue. You are research of the gastroenterology department, and you are asked to discuss this issue with her. The scenario is clear, Dr. Nagla? The scenario is clear?
Yes, she has ulcerative colitis for the last 6 months. The consultant decided to start the steroid, and she decided not to receive it because of what she read about it in the internet.
Yes. Okay, you have 5 minutes to prepare yourself before going to inside to meet the surrogate. These 5 minutes, are the most important 5 minutes to write your headlines we are going to discuss, and you have the right to read to make the list of the headlines you are going to discuss with the surrogate, and even you have the right to take the white paper with you and to make it in front of you while discussion with the surrogate.
I task your doctor and now discuss with her the management plan or discuss her decision. What is the task?
This is actually a scenario of counseling for side effect of drug. Your task is to convince the patient to receive steroid. She is very anxious and irritated after reading the side effects of steroid. So your task is to convince her that the steroid is the drug of choice and the best interest of her condition.
Yes, okay.
So counseling before side effect of drug can come in multiple scenarios. Actually, it can come in side effects of steroid, for example, such in this case, or maybe warfarin side effects in other case. The patient has pulmonary embolism and warfarin was prescribed for her, and she is very anxious and afraid of the side effects of warfarin. So the skeleton would be the same. It is counseling for the side effect of drug.
Okay.
We can start.
Yes. I start, doctor?
Okay, Dr. Ananda, you can start.
Good morning, Ms. Heba. I'm Dr. Naglan, the Senior House Officer in the Gastroenterology Clinic. Pleased to meet you.
Good morning, doctor. Nice to meet you.
I want to confirm that you are Ms. Heba, 27 years old. That's right?
Yes, doctor.
Okay. We are here together, Ms. Heba, today to discuss your medical condition. Is that okay with you?
Yes, doctor.
I understand that you are having chronic loose motions for the previous 6 months. And how much do you know about your condition?
Yes, doctor, I have this loose motions for the last 6 months. Doctor, they did for me some blood test and a camera test, and they told me that I have a disease called ulcerative colitis. And the gut physician prescribed for me medication called steroid that I have to be on for a long time, doctor. Actually, I read about this steroid therapy, and I knew a lot of complications and side effects. I'm very anxious and I'm very hesitant to receive this drug, actually, doctor.
Well, Ms. Heba, I appreciate your awareness very much, but I just want to know that how much do you know about this ulcerative colitis? Do you have any idea about this disease?
I have been told some information, doctor, like it is a long-standing disease inside my entire gut, causing some soreness. That's why they prescribed for me these medications, and they told me this medication I have to be compliant on for a long time, doctor.
Yes, Ms. Heba, that's right. Actually, ulcerative colitis is a disease which is affecting the whole food tube, which is called the colon. And it is a serious disease because it causes soreness of your whole food tube. And it is like the doctors told you, it needs to be treated because it has a lot of impaction of your life. It is causing loose motions and also can affect other parts of your body. So it is disease should be taken seriously, not to be taken lightly. And I've understood that your consultant that decided for you medications which called steroids. You've read about it on the internet, and anyone of your surroundings have received this treatment before?
No, doctor, just I got my information from the internet, doctor.
Yes, Ms. Helen. Actually, steroids, like any other medications, having its good side and the bad side. But what is the important issue we have to discuss today is the effect of this steroid on your disease. Because this ulcerative colitis that you had should be treated in a certain way. And the steroid will help increase in this soreness. And the soreness present in your colon, if not treated properly, could causing a scarring on your food tube, and on the long run can be affected in a bad way. Even steroid will not be effective. That's why you need to start the treatment for you as early as possible, get the benefit out of it. And as the Fred, it has some side effects, but what we are going to try to do with you is to do some balance between the effect, the good effect that the drug will affect, and the bad things that could happen to your disease if you don't take the medications. Am I clear for you, Ms. Heba?
Yes, doctor, and how you are going to do this balance?
We are going to try to give you the dosage of this medication, which could affect the soreness present in the colon, and at the same time, we are going to follow you up in the clinic. You are not taking the medications on your own, and we are not going to leave you for that. We are going to follow everything that this steroid can cause, and so try to prevent it or to treat it as early as possible. In the same way, we are following up the impaction of this treatment on your colon. And you have to know, Ms. Noha, that if you, Ms. Heba, that condition can become worse and worse. And at a certain point, maybe this steroid or other things cannot be effective for that. And also, this treated properly. So you this way and
Hello?
yes.
Okay.
May I ask you, Ms. Heba, do you have any, do you smoke?
What, doctor?
Do you smoke?
No, doctor, I don't smoke at all.
Do you drink alcohol?
No, doctor.
What about your food habits? Do you like spicy food?
Uh, yes, doctor. Actually, the dietitian he make multidisciplinary team for me, and the dietitian told me to avoid spicy food as much as I can, and he make some list of types of food I have to be compliant and I have to avoid.
Yes, that's great. And you are compliant to that right now?
Yes, doctor. I'm trying my best.
That's great. And is there any member of your family having a cancer problem?
No, doctor. Why you're
That's
asking
great
this
news.
question, doctor?
This is very important for us for looking at for having a future outlook for your case, Ms. Heba, because if no one in your family having a cancer, that would be a good point. And if any one of them having a cancer, especially in the colon or any other place, that will raise us a red flag to be worried about. Still, ulcerative colitis is a disease which should be taken seriously. And we have to take this medication in this way because this is the proper way to trying to treat it. On the other hand, there are other medications that could be also effective, but they are not giving the same effect that the steroid give and the healing properly of the soreness present in your colon. Do you have any question, Ms. Heba?
Yes, doctor. Is there any alternative, doctor, to this steroid?
Yes, Ms. Heba, there are alternatives for medications to be given in cases of ulcerative colitis. But these medications have the side effects too, because I've told you before that no medications has no side effect. Everything has its good side and its bad side. What we are trying to do is giving you the advantage of having the best side out of this medication in treating soreness and follow you up on a putting a close eye for you to try to prevent side effects. If you would like me to set another appointment with the consultant for discussion the other possibilities that you have, that would be nice for me.
Yes, doctor.
What is in your mind right now? What's going on in your mind, Ms. Heather? You can share me with your ideas and I can address any other problem that you are thinking about.
Yes, doctor. For how long I'm going to receive this medication, doctor?
You are going to take this medication for at least 6 months, and then we are going to reassess the condition according to how do you feel, according to the number of loose motions that you are having every day, and the general condition of you. This is very important in thinking about how long the medications will be continued.
Yes, doctor.
Still, do you have any other question you want me to answer?
No, doctor, actually, but I still don't feel comfortable with this medication, doctor. I feel that its side effects may be more than its benefits, doctor, actually.
Is there any particular side effect you are worried about?
I read about a lot of side effects, actually, doctor.
But no specific one you are worried about?
Yes, doctor. For example, weight gain, doctor. I think it will irritate me so much that I'll have weight gain because of this drug.
Yes, actually, Ms. Heba, I appreciate your concern very much about having gaining weight. Actually, steroid may have this gain weight, but still we can give it to you not in a tablet. We can give it to you through a tube coming to your back passage, which can give the treatment locally to affect the soreness of the colon. And in this condition, we can overcome the problem of having a gaining weight.
Yeah.
What do you think
Oh
about
my God,
that?
doctor. You are going to be to give me the medication, doctor, into my bag.
And through your back passage, Ms. Heba.
It will be so painful, doctor. I don't think that I'll tolerate this way of treatment, doctor.
It will not be painful at all, Miss Heba, but if you are not feeling comfortable about that, we can think about another thing. I am trying to offer you the whole solutions for your problem, and I want you to share me in taking the decision of controlling your disease with putting in your mind it is a serious thing, should be treated thoroughly, so to prevent you from the bad outcome of it.
Yes, doctor.
Can you tell me, Ms. Heba, what do you get out from our discussion today?
Yes, doctor, I knew that I had to receive this treatment. It's a good treatment for my condition to improve my condition. And that the benefits are maybe more than the risk or the complication of this treatment. And I have to receive it for 6 months, then to be reassessed again. Thank you, doctor.
What is your concern, Ms. Heba?
Yeah, my main concern, doctor, for how long I'm going to receive this medication, and if there any alternative treatment.
Do you have any other question or concern I can address you?
No, doctor.
Okay. Are you socially supported, Ms. Heba? You are living with whom?
I'm living with my husband, doctor, and I have 1 kid.
That's great. And you are financially supported?
Yes, doctor.
Okay, that's great too. Okay, thank you, Ms. Heba.
Thank you, doctor. 2 minutes remaining. Okay.
Okay.
Thank you, Dr. Nagla. Discussion with the examiner. Do you think the doctor convinced the patient to receive the medication?
Well, I at least make her rethink about not to take it, because maybe she will not change her mind on the spot, but it will at least rethink and reconsider taking the medication as it is for her best interest.
What did you do, doctor, to convince the patient to receive the medication?
I've explained to her the seriousness of her disease and that could be turned into cancer, and the importance of taking the medication on her health and on her improvement of general condition, especially the chronic diarrhea that she's complaining from.
Okay, did you explain the side effects of this medication to her?
Should I explain the side effects? She already read about it.
Yeah, but you didn't ask what did she read about the side effects and what information she know about the side effects of the
I've asked her about that, and she told me, and I asked her specifically if anything is specifically concerned her. She told me about gaining weight.
Yeah, what if the patient didn't read about any side effects, specific side effect? The patient has the right to know all the side effects of the drug, isn't it?
Yes.
Okay. What's the ethical issue here, doctor?
The ethical issue in these conditions, the patient's autonomy. She has the right to know the specific condition that she has, and all the complication side effects, and also the complication, the pros and cons of the taking or not taking steroids. The beneficence that I'm trying I'm trying to treat the patient in a proper way and non-malevolence, which is not doing no harm for the patient. And the justice should be treated equally as the other person, irrespective of her age, sex, or color.
Okay. Thank you, doctor.
Thank you.
Okay, well done, دكتورة نجلاء. يعني مش well done قوي, لكن let's do open discussion. Okay, open discussion. Anything may be missed from دكتورة نجلاء here, or anyone has any comment?
Yes, Dr. Sadiq, please. Yes.
Who is talking?
Yes, I am Dr. Magid, Dr. Sadiq.
دكتور ماجد, أهلا بيك. اتفضل يا دكتور ماجد.
ازيك Allah يخليك يا فندم. I think Dr. Sadiq, it is better to say to patient, we will not give you corticosteroid for long period. We will give you a corticosteroid only during the flare up of your condition, and we will stop it after your condition will become stable. This will give us a chance to convince the patient about giving her corticosteroid. Because I think the patient may misunderstand that she will take corticosteroid for a long time.
Yes. So you don't agree with Dr. Naglat that the patient will take steroid for 6 months, according to her?
I don't know exactly the period. I
Yes.
don't know exactly the time patient will take, but I'll try to convince her. We will give her as short as possible and as least as possible doses until her acute condition becomes stable. And after the condition becomes stable, stop corticosteroid.
Yeah, so generally steroids are given during the flaring up of the disease, not for
Yes.
long life. Okay,
Yes.
this is the point. Okay, Dr. Marwa? Okay, any other one has any comment?
Dr. Sadiq, we can start with flare up with prednisolone, but at the same time we can start with steroid sparing drug like immunon azathioprine. So we can tell that at the meanwhile symptom will settle. So we can taper this steroid and we will continue over this steroid sparing drug.
Yeah, actually it is not our task here to tell the patient about the specific treatment he is going to receive, azathioprine or salicylic acid or whatever, or steroid. Our task here about steroid, so no need to mention other treatment options there. But we have to tell the patient that steroid is given only during the flaring up, and after her condition stabilizes, we can withdraw this steroid. But still, the patient can take steroid for a long time, maybe for weeks, until her condition to be stabilized, so that she may have the side effects as well. Okay. Naha, do you have any comment?
I think if she speaks about the complication like cancer, maybe the patient will be concerned.
Now your voice is far actually.
I'm saying if she is speaking about the complication of ulcerative colitis, like cancer, and the high chance she will get cancer if she will not treat it well,
yes,
I think the patient will be convinced.
Okay, I agree with you. Okay.
Sir, I just want to add one thing. It's a very good case. Dr. Najla presented very well, first of all. But I just want to mention, when she's asking the questions, you are continuously mentioning, does there is any other treatment I can get? So I think that in this scenario, we have to tell the first, we have to find out the severity of the disease while asking the question, how the severe is the disease. Then accordingly, we can convince the patient by deciding first the severity of the disease, because in the scenario, it is not mentioned how severe is the disease. So once you find out the severity of the disease, like if it's severe attack of ulcerative colitis, then and you can tell and convince the patient.
And how you are going to assess the severity of the disease, Dr. Farhan?
Sir, by asking a little bit of history of loose motion, how many times there is loose motion, and there is one criteria.
About, something here in the communication. Don't take history at all. Communication, don't take history at all. Here, Dr. Nagla asked about family history of cancer. Dr. Farhan wants to ask about how many times, if there is fever, what about hemoglobin. No, this is not our task here. It is not a case of history, it is a case of communication skill. You have a specific task you have to judge and you have to approach. Don't ask about history in the case of communication at all. Okay? So, regardless the severity, steroid is prescribed here for the patient. We don't know how long, but the patient may have the side effects. So your task is to convince the patient about the steroid and to be honest with the patient, to inform the patient about the side effects and how you are going to overcome these side effects, and to convince the patient that these side effects are outweighing the risk versus the benefit of this treatment. The benefits are extremely more. So that's why in the 5 minutes, it is very important to write your headlines you are going to discuss with the patient, to organize your mind, how you are going to approach. So let me to ask Dr. Nagla, what did you write in your white paper, Dr. Nagla, before going to inside?
Well, I wrote that I have to explain to her first the seriousness of her disease, especially ulcerative colitis can turn it into cancer if not properly treated. And I would raise up to my mind that it may be we need, if it's not treated well, to make a collective. But I didn't mention it in the discussion because it could raise up her awareness up to the ceiling if she knew that if we not treated her condition in a well way, that we will have to cut her colon. And I wrote that I have to discuss with her the importance of taking medications for healing. And yes, steroid has its side effect, but we can give her steroid in so many methods, including that steroid enema could be given in this case. And I would raise also the importance of having another meeting with the consultant if she doesn't accept my medications in the last. And I would like to ask her about the post-family history of cancer to raise a red flag of maybe underlying problem.
Okay, I think no need to ask about history at all. No need to ask about family history of cancer at all. Actually, even if there is no family history of cancer, the patient still has risk of cancer, of long-standing and controlled ulcerative colitis. So family history of cancer or not, I think will not give us a big value here. So please don't take history during the communication session. Okay, for me, I'm going to write my headlines like that. Number 1, introduction. Okay. Number 2, giving a hint about ulcerative colitis without jargon. Number 3, advantage of steroid. Number 4, disadvantage of steroid. Number 5, how to overcome this disadvantage of steroids. And after that, I can say social history, concern, checking understanding, summary, checking understanding, and the help. This is the headlines I'm going to write in my notes before going to the station, and to put it in front of me, not to forget something. Okay, so my approach would be like that. Introduction, introduce yourself, confirm the patient identity, confirm agenda of meeting, okay, and then ask the patient how much information you know about ulcerative colitis. Okay, how much information did you get from the internet about steroid? To know how much information or side effects the patient know about steroid. Okay. Then I give hint about ulcerative colitis. Actually, this is not a case of counseling for ulcerative colitis, so no need to mention all the information about ulcerative. I'm going only to mention ulcerative in one line only. Okay, like you know, ulcerative colitis is a long-standing disease affecting the entire surface of the gut, causing soreness and inflammation. So, steroid was prescribed by the gut physician for you in the best interest of your condition. Then, advantage of steroid. Actually, steroid is very important treatment in your condition to control your ulcerative colitis. And it was prescribed by the gut physician in the best interest of your condition. And you have to be completely compliant in your medication to to control your condition and to avoid complication of this disease. Okay. Disadvantage of steroid. Steroid, like any other treatment, has its own complications, and you have to mention all the complications of steroid. You have to be honest with the patient, actually, like weight gain, high glucose level, high blood pressure, fragile bone, some electrolyte disturbance, okay, and maybe some disturbance of your defensive system. But how you are going to overcome this complication? But we are going to do regular follow-up for your condition to be sure that you are completely free from any complications and to manage any side effects of the drug you have. And outweighing this versus the benefit of steroids, the benefits are extremely more. Okay? Yeah. Then again, how to prevent the patient? Actually, ulcerative colitis is a long-standing disease and may have a lot of complications. And one of them is maybe developing cancer if your condition is controlled. But if you are completely compliant with your medication and your condition is completely controlled, the chance of cancer in your condition would be extremely rare. Like that, I finished my case, actually. And from time to time, you have to check understanding of the patient. Is it okay with you? Does it make any sense for you? Okay. So, Dr. Nagla here didn't mention any side effect of the drug, and we said that the side effects has to be mentioned all, like weight gain, high glucose level, high blood pressure, electrolyte disturbance, fragile bone, and maybe disturbance of the defensive system. And then after that, directly you have to inform the patient how you are going to overcome these complications. But you are going to do regular follow-up for your condition to be sure that you are free from any complications and to manage any side effects you have at all. Okay?
In this case, Dr. Sadiq, I should mention the side effects. I thought about if I mentioned the side effects that make things worse. I thought my task is to convince her with the treatment. That's why I didn't mention.
Actually, in the communication, you have to be honest with the patient. You have to mention everything for the patient. Don't hide anything at all. The patient has the right to know everything about his condition, his autonomy. And at the same time, you have to convince the patient also to take the treatment. And how treatment is important for his condition, to control his condition, to live near normal life.
Yes. What I was thinking about that she already had an idea about side effects. That's why I didn't mention them. But maybe I should repeat
even if the patient has or know about the side effects, you have to mention for her as well.
I have to mention them again, yes. The follow-up will be general, Dr. Sadiq, as I've told her, that I will follow you closely, or I would mention that I will make an eye doctor look at you, or like that. Which of which? In general, I will follow up, or I will make an eye doctor look at you and the gland doctor check your sugar and things like that.
You mean that every complication you are going to cover?
Yes.
Actually, no need for every complication but it's okay. When, for example, for blood pressure, we are going to check your blood pressure from time to the other. For your glucose level, we will check your glucose level to be sure that is within normal range. For fragile bones, we can give you some medication to control your bone density. It's okay, I agree with you. If you want to give treatment for each special or specific side effects, it's okay. This will be great. Okay.
Yes, great.
Okay, for the weight gain, for example, if the patient, sometimes female patients are very irritated because of weight gain. Okay, you may have this weight gain for a time, but after stoppage of this steroid, you will resume your normal weight again. Okay, this will be for only temporary time. Okay. For how long I'm going to receive this medication, doctor? Actually, this medication is given to you by the gut physician during the flaring up and activity of the disease for time. And this will be decided by the gut physician himself according to the activity of your disease.
Yes,
There is
I
no
would
other
not give her
alternative,
time.
doctor. Actually, steroid is prescribed for you in the best interest of your condition to stabilize your condition. Any other alternative treatment to be discussed with the gut physician himself.
Yes. So I will not give her a specific time. I will tell her that we are going to give you this treatment according to your response and your improvement of general condition and the symptoms. Then we are going to decide for how long you are going to take it. That's
Yes,
right?
so the duration to be decided by the gut physician according to the activity of your condition.
Okay.
And actually, I don't like to talk so much in the communication. If we are talking so much, it means that you are pushing a lot of information to the surrogates, and they don't like that actually. Number two, if you are talking so much, you will make a lot of mistakes. So make your words are simple, and if you words are targeted, without talking so much. Okay.
Thank you very much, Dr. Soda.
You're welcome, Dr. Nagla. So again, the headlines to put on our mind before going, this is very important. Write the headlines, your introduction, okay, introduction, give hint about ulcerative colitis and the complication of ulcerative colitis, advantage of steroid therapy, disadvantage of steroid therapy, how you are going to overcome the side effects of steroid therapy, okay, and after that, the social history involving the 4 questions: with whom the patient is living, who is supporting the patient at home, if they are doing well or not. Number 2, what's the patient's job and how much her disease affecting her job and usual daily activities. Dr. Nagla didn't ask about it, and it is very important. Number 3, is the patient financially supported, smoking history, alcohol history. Then ask about the concern. Then after the concern, check understanding of the patient, do summary, or you can do summary first and check understanding later on. Help for the patient. I'm going to give you some leaflets about steroid therapy, and I'm going to give you my contact number as well. If you have any worry or query at any time, you can contact me. If the patient is still not convinced after you explained all for the patient, you can involve your consultant at the end. Okay, I can involve my consultant to convince you more about this treatment if you want. Okay, any other question here? Okay, next case will be for. I don't want to leave them. Okay, Doctor. Who's going to Egypt first? Dr. Nagla and.
دكتورة نهى يا فندم
Dr.
بقى
Noha,
Egypt.
okay. It's going to Egypt. Dr. Noha, Mr. Ahmed is 27 years old. This is station 5 case. Mr. Ahmed is 27 years old. He has been complaining of neck lamp for the last 6 months and short suppress for the last 2 months for your kind care.
Shortness of breath 2 months?
Yes, neck lamp for 6 months and short suppress for 2 months. Of course, here I have to link the short suppress of the patient to the neck lamp he has, okay? There's not a case of short suppress, because short suppress has a lot of differential diagnosis or wide differential diagnosis, cardiac causes and pulmonary causes and whatever. But we have, this is very focused, station 5 is very focused and brief consultation. So you have to keep in your mind that shortness of breath is related to the neck lamp of the patient. Okay, you will start, Dr. Noha?
Good morning, Mr. Ahmed.
Good morning, doctor. You are going to talk with Mrs. Hala, sister of Mr. Ahmed, to be used that you are in the exam. Okay.
Okay. Good morning, Mrs. Hala.
Good morning, doctor.
Good morning, Mr. Ahmed.
Good
I'm
morning.
Dr. Noha, the doctor in the medical outpatient clinic. Nice to meet you.
Nice to meet you, doctor. Okay, Dr. Noha, when you get inside the room, you saw the patient has a diffuse neck lamp and the signs of Graves' disease, actually. Okay.
Okay. Mrs. Hala, may you tell me about the complaint of your brother?
Yes, doctor, my brother has been complaining of this neck lamp for the last 6 months, doctor, and for the last 2 months he's complaining of this shortness of breath, doctor.
Is it with exertion or all the time?
This shortness of breath, doctor, or what?
Yes, shortness of breath.
Yes, with exertion more, doctor.
Does he feel shortness of breath when lying flat?
No, doctor.
Does he awake due to shortness of breath?
No, doctor.
He have any leg swelling?
Yeah, there is some leg swelling, doctor, as well.
Both legs?
Yes, doctor.
Is it when you put your finger, it makes a finger mark?
Yes, maybe, doctor, yes.
Okay. Mrs. Hala, about the neck swelling, does he sought any medical advice for it?
No, doctor.
So he's not receiving any treatment for this neck swelling?
No, doctor.
Okay. Does he have any medical problem before?
No, just this neck swelling, doctor.
And he is not receiving any medication?
No, doctor.
Okay. And does he have any cough?
Yes, there's sometimes there's cough, doctor.
Is it with phlegm or dry?
Mostly it is dry, but sometimes phlegm, doctor.
What's the color of the flag?
White, doctor.
He's smoker, Mrs.
No, he don't
Hala?
smoke at all, doctor.
Okay, good. He have any joint pain?
No joint pain, doctor.
Any skin rash?
No, doctor.
He have hot intolerance?
Yes, doctor, he has heat intolerance. He cannot, he prefer cold weather, doctor.
Any rating of his heartbeat?
Yes, doctor, sometimes.